Now we're going to take you back to India, where the coronavirus surge is worsening. As hospitals and morgues remain overwhelmed, supplies like oxygen and vaccines are becoming increasingly tougher to secure. The nation reported more than 386,000 new cases of the virus Thursday, but as Holly Williams reports, the real number is likely much higher.
India is in a life and death battle, fighting the same virus as the rest of us, but with a fraction of the resources it needs. People are dying, gasping for air because hospitals have run out of oxygen. While on the street, those who can afford it buy tanks of it to keep their loved ones alive.
I'm just heartbroken. I just can't explain, but I get a call every 20 minutes about someone that I know or, their parents or someone who's dying.
Professor Ramanan Laxminarayan is an epidemiologist who we previously interviewed in 2018 for 60 Minutes. While India's official death toll is just over 200,000 people, he believes the real figure could be 6 times as high, more than twice that of the US.
Right now, you don't need the numbers. You could just have to go out into Delhi. The smoke is thick in the air. It is just, it's just constant. It's just constant.
He's talking about India's crematoriums, where funeral pyres are now burning 24 hours a day. And there's no end in sight. Less than 2% of India's more than 1.3 billion people have been fully vaccinated.
It's not just India, it's Bangladesh, it's Africa. There are hidden epidemics everywhere.
Is the West being selfish, looking after its own people, vaccinating its own people and not thinking about India?
And no one is safe until everyone is safe. And I think we need to really think about that as our guiding principle.
Holly Williams, London.
So more on the crisis in India now. I want to bring in former CBSN producer Athyunnath Eleti. He is in Hyderabad, India. So good to see you, my friend. It's been a very long time since I've sort of seen you in the flesh and blood. So where you're at, it's sort of central India. Can you give us a sense of what the conditions are like there? And I don't know if you're familiar with, India did very well on sort of the first wave of the coronavirus. So can you give us a sense of what things were like back then and what they're like now? What are you seeing and hearing?
Anne-Marie, there's a sense of unease that's definite in the air. People are uncertain about exactly how serious the virus is. And those that are trying to take precautions don't know just how long the lockdown is going to continue, how long do they need to quarantine, what are these new variants. There's just a lot of questions which are unanswered. So India did have an initial wave of coronavirus, as many countries did, and it went into lockdown, it started producing vaccines, it tried to get as many people inoculated as it could. And there was just a sense of peace afterwards, where the Prime Minister, Narendra Modi, and other politicians started to say that India has finally beaten the coronavirus and we are ready to come back out of lockdown. And starting in January and February, things like weddings started to happen again. Kids could go back to school. Political rallies started to happen, as it's an election year right now. And the surge began again. And now there are new variants which are deadlier and spread faster than the old ones. But it's harder to test for them because we are running out of testing supplies. So overall, there is just a drastic sense of what is going to happen, when is this going to end, and is there going to be an end to this? Mm-hmm. Even now, right now, in my family, we heard about a death this morning, and it's hard to deal with it on a daily basis, and there is a definite sense of COVID fatigue. But there's also this sense of distrust, as there are no clear answers, there's no clear leadership, and we are worried about what's going to happen next.
Oh, that's very interesting. You returned to India actually not very long ago. What was the return like? What were the travel protocols like?
So as a rule, India's travel protocols are that you need to be tested 72 hours before you take your airplane. And I did that. I did get a negative COVID test before getting on the plane. And once I had a layover in Dubai. And for my flight from Dubai to Hyderabad, we were given face shields and face masks. And once we land in Hyderabad, we were asked to pay for a test to get it ourselves, even before going to immigration. Now, that in theory sounds like an acceptable plan, but the reality is much different. There is no social distancing enforced. There was no mask protocol enforced. People lined up as quickly as they can. It was like a rush to get out of the plane and get back out of the airport. And even after getting the COVID test, it takes about 2 to 3 days to get the result, unless you're a transit passenger. And once you step out of the airport, though, it's all hands free. There's nobody who's checking up on you. There's nobody checking to see if you're actually following quarantine protocols. So once you step out of the airport, you can do whatever you want. So there's a lack of follow through and a lack of enforcement. But in theory, India has laws which say that, no, not laws, but India has guidelines which say that you need to get tested, and if you test negative, you can come out, otherwise you need to fall on quarantine. But the enforcement is a critical issue.
Right, it's pretty much a sort of an honor system. One of the things that we learned in doing this coverage is that that India actually has a number of vaccine manufacturing plants. It's one of the countries that makes vaccines for the rest of us in the world. And now Reuters is reporting that some states in India have run out of vaccine supply. What can you tell us about the rollout of the vaccine distribution? How is that plan working?
So there's a drastic difference between how vaccine rollout worked in the US as compared to India. In India, it's the pharmacies are just storefronts where you buy medicine. So it's not like you can walk up to a Walgreens or a CVS and line up to get a shot. The shots are given at hospitals, and hospitals are currently overflowing with COVID patients desperately trying to cling on to life. So getting the vaccine itself has been extremely hard. The WHO reports that right now there are 2 to 3 million doses being manufactured every day, but we require 6 to 7 million being manufactured to meet the current surge. But every day we wake up and my parents get on the phone and call local area hospitals to see if they can get a shot, and have been unsuccessful throughout. Even those who got a shot, as reported, got the first shot and are unable to get appointments for the second shot. So even then the vaccine loses its efficacy as you wait and wait for your second dose. So in both areas, whether you have a first shot or you don't have a shot, it's very hard to get a vaccine right now.
Well, Athyunnath, I'm really sort of happy that we were able to talk to you. If people are wondering why they haven't seen you yet in this video or in a little while, it's because your shot is frozen, but we can hear you, and you're painting, a very dire picture. I hope you and your family stay as safe and healthy as possible. Oh, there we have you back. Oh, you're still frozen. But and I really appreciate you taking the time out to talk to us. Thank you.
Thank you.